Thanks, Premier, and good morning, everyone. Good afternoon, everyone. So, as the Premier mentioned, we've got good immunisation rates at the moment across the community. In people aged 16 years and over, we now have 95.1% having their first dose and 93.7% their second dose. Of people aged 12 to 15 years, 81.5% have had their first dose and 78.1% have received 2 doses. So while those rates are good, there's still room for people to be immunised, and we know just how effective immunisation is in protecting from severe disease. So it's important for your own protection, but also for the protection of your community, family and loved ones to just go and get that first shot if you haven't had it already, and make sure you follow up with your second shot. And of course, now that boosters are available for people 4 months after their second shot, go and make sure you've booked in to get a booster shot if you haven't already done so. In terms of hospitalisations, we currently have 1,927 people with COVID in hospital in New South Wales, 151 of whom are in intensive care and 38 are requiring ventilation. And there were 30,062 cases reported yesterday to 8 o'clock last night, and more than 98,000 COVID tests reported. Now, we know people are taking up the RAT testing, the rapid antigen testing, and so that's going to then mean that the PCR tests that we're reporting will come down as we see more people take up the RAT testing. As the Premier mentioned, we're very sad to report the deaths of 16 people today, 8 women and 8 men aged in their 60s, 70s, 80s and 90s. 7 people were from southwestern Sydney, 2 were from southeastern Sydney, 2 were from western Sydney, 2 were from Sydney's inner west, 1 person was from the Central Coast and 1 person was from the South Coast and 1 from northern Sydney. This is the highest number of deaths we've had in any single day. Note that in the end of September, early October, reported 15 deaths on 2 days in the Delta outbreak. So again, our condolences and sincere condolences to the families, loved ones and friends of these people who've sadly died. As Premier mentioned, RAT testing is becoming more widely available, and this week we're working closely with Service New South Wales to allow people to register their positive test result, and that will help ensure that people who've registered will be plugged in to the health system so that they'll get advice, and if they're in high risk groups, be able to have specific additional processes in place. If you have a rapid antigen test, you generally don't need to have a follow-up PCR test, so that will make it quicker and faster for people to know their status, and as well as relieving pressure on the testing system. And please follow the advice. If you do have a positive RAT test, please assume it's the equivalent to a PCR test, so you'll need to isolate for 7 days, and you'll need to tell your family, people in your household, to isolate for 7 days as well, and also have RAT testing. And it's really pleasing to see that from tomorrow, the vaccinations will begin for children aged 5 to 11 through the vaccination centres run by the state and local health districts, as well as through GPs and pharmacies. So please take the advantage, come and get forward for vaccination. If you haven't booked already for a vaccine for your child, please do so now. Thank you very much.